Hi, good morning, good afternoon, good evening, wherever you're joining us from around the world. Welcome to the first of many series of the Africa Digital Rights Hub Webinar Series. This is the first of many webinars we'll be holding around topical issues around the world and specifically pertaining to Africa on privacy and data protection, on intellectual property and child online protection. This morning, we have been very lucky to have been joined by very eminent experts to discuss the issue of the best approach to COVID-19 contact tracing. At the end, we'll be joined by 3 speakers. I'm going to go in order with which they will be speaking. The first is Dr. Nuria Oliver, who is the Commissioner for AI and COVID-19 at the Valencia government, and she's also a Chief Data Scientist at Data Pop Alliance and as Chief Scientific Advisor with the Vodafone Institute. She's the member of the Ellis Board, a Fellow of the Spanish Royal Academy of Engineering, Fellow of the IEE, the ACM, and the European Association of AI. Thank you, Nuria, for joining us, and we look forward to hearing on your experience on this topic. After Nuria, we'll also be joined by Mr. Felix Duku, who is the founder and CEO of Duku Consultants and a consultant for the World Bank project on digital transformation of credit unions. Felix has over 13 years of varied experience in IT, mostly in banking and the finance industry. His main strengths are in enterprise digital transformation, core banking systems, the development and deployment of successful IT strategies, properly aligning digital technologies with enterprise business objectives. Felix has a wealth of experience in developing and implementing digital banking systems, financial transaction assurance systems, credit orientation systems, as well as electronic payment systems, including switching platforms and core banking systems. He has been in several engagements across banks in Africa and other countries as well. Thank you, Felix, for joining us, and we look forward to hearing your experience on this topic. Finally, last but not the least, we will hear from one of Africa's first data protection authorities, that is Mrs. Drudesha Madha, who is the Data Protection Commissioner for Mauritius. Drudesha has been the Data Protection Commissioner for Mauritius since its establishment in 2007. She is a British Chevening scholar, and holds an LLM in international rights at the Essex University. Rhodesia was also one of the first countries in Africa to host the International Conference of Data Protection Authorities. She will be joining us. She's not with us now, but she will be joining us as we commence this discussion, since we're working at the back end to ensure that they're able to join us smoothly. And so thank you very much, ladies and gentlemen, for joining us. This is a very exciting period for us as ADRH, and we're trying as much as possible to make use of our new normal, which is preventing traveling and meeting up with people to have these kinds of interactions. As I mentioned from the beginning, this is one of the first of a number of webinar series that ADRH will hold on its areas of interest. And We will be using one of these first series to talk about one of the most important things that we've all been talking about around the world, which is COVID-19 contact tracing. There's no doubt that, this pandemic has brought to bear the need of all kinds of data, be it mobility data, be it location data, be it health data, and all kinds of data that is necessary to enable us manage this pandemic well. But from where we sit as ADRH, and based on the number of things that we've seen happening in Africa and across the world, we've noticed with concern, particularly issues around contact tracing. And so this morning, we want to engage all of you coming from 3 different backgrounds, from purely technical, from the data scientist background, as well as from the privacy and data protection regulatory background, to talk to us about what you consider as the best approach to contact tracing, so that we are able to allay the fears of many on how to be able to do this right. Interestingly, we've been joined, even though this program is targeted mostly to Africa, we've been joined by participants from all over the world, to name the least, from Russia, Ireland, Spain, Ghana, Nigeria, Kenya, Ivory Coast, and the rest of the world. And so we're very excited to be having this discussion on the global level. And without saying much, I welcome all of our speakers, and I just want to run through how we will go about this. I will give each of you an opportunity to give us your opening remarks on the topic of discussion, and then we can have some interactions with each other based on follow-up or questions that we may have for each other on the issues that we bring up during our opening remarks. We will then go to our audience to take some questions that they may have, to try and answer some of the pressing questions which may have come out of your discussions. And so without saying a lot more, I just want to invite you, Nuria, to share with us, from your perspective, what is the best approach to COVID-19 contact tracing?
Excellent. Thank you very much. And thank you so much for the opportunity and for the invitation. I will go really fast because I have a lot of things that I would like to say in a short amount of time, all related to contact tracing. Before I do so, just to bring some context, I was named in March Commissioner for the President of the Valencian region in Spain on AI and data science to fight COVID-19. So this is the Valencian region within Spain. It's a region with 5 million inhabitants and is very well known for its tourism because it has wonderful beaches and touristy places. Within the Commissioner, I established 4 working groups and a team of 20 plus experts, and we are all volunteers that are working very closely with the president of the region in trying to help make better decisions using data science and using scientific evidence. We are working on analyzing mobile data to understand human mobility, on building epidemiological models, on building predictive models, and on citizen science. I'm not going to talk about any of this today, but I just wanted to bring some context. What we are also been investigating and thinking a lot about is contact tracing, because as we reach the peak in our region was on April 6th, we reached the peak of infection, we entered into a different phase of the pandemic, such that the early detection of the maximum number of positive cases is very important, so they can isolate themselves and therefore prevent community transmission and prevent a second wave of exponential growth in the number of cases. In that context is where contact tracing plays a very important role. The goal of contact tracing is to identify as early as possible and alert people who have come in close contact with a person infected with COVID-19. It is a traditional technique used in epidemiology, and usually it is done manually by carrying out an epidemiological interview with every positive case. So every positive case gets a phone call from the contact tracing team, and in the phone call, they ask them a lot of questions, including with which people they have had a close contact in the past N days, for example, the past 2 days or the past 5 days. Immediately after that interview, the contact tracer calls the people that the person has reported that they have had close contact with to assess their state of health and also to determine the risk of having contacted COVID-19 and to ask them to isolate themselves. The traditional method has a number of challenges, and everyone in the world, it hasn't really scaled at the speed of growth of the COVID-19 cases. So what are the limitations? The first one is that it relies on the memory of the person. The person has to remember whom they were in contact with. The contacts also have to be known. They have to have a name and a phone number, because the contact tracer is going to call them afterwards to ask them about their health and to tell them that they might have contracted COVID-19. It also doesn't work very well across borders if the teams in the different countries are not sort of like talking to each other and sort of like coordinated, and it's very human, and resource intensive. And that's where the idea came about using mobile phones, and particularly smartphones. Smartphones penetration is very high, and we could think about using the phones, given that they're always with us, to automatically detect the people that we were close by. There have been different approaches on how to use mobile phones for contact tracing. The early efforts, mainly in Asia, in China, and in South Korea, were using GPS, cell tower information, alone or in combination with other sensor data, for example, credit card transactions or even surveillance camera video. This approach has a lot of serious privacy implications and also has practical limitations, and that's what has drawn the attention to the Western world and the rest sort of like of the countries to look into Bluetooth as a technology that could enable the phones to detect the proximity to each other in a more privacy preserving way. The advantages of Bluetooth is that it is privacy preserving because you don't know the location. You in principle don't know any personal information. All you do is record which devices are near your devices. It's decentralized because it's device to device. It works much better indoors and in moving environments than GPS, which of course doesn't work in an airplane. It doesn't work inside buildings. And the first country that developed a Bluetooth-based contact tracing app was Singapore, and they've been using it since then, but with a lot of difficulties, as I will explain. And today there are dozens of efforts in the world on using smartphone apps for contact tracing. If you are interested, MIT Technology Review has a list of all the countries and the apps and the technology that they're using to do contact tracing. How do these apps work? Generally, they all follow the same principles. The smartphones generate an encrypted pseudonym. It's called a temporary contact number or a beacon or a TCN. And this pseudonym, which is encrypted and it doesn't contain any personal information whatsoever, is exchanged with the other phones that are also running the app using short-range, low-energy Bluetooth. As people move around and they encounter other people, their smartphones keep exchanging these TCNs, and the list of the TCNs that they encounter is stored locally on the phones. So the contact trace is stored locally on the phones in the form of these encrypted TCNs. If one of the persons tests positive, then with their doctor, they would activate a signal in their app telling that they were positive, given this special code, and then an alert would be sent to all the people whose phone had been in close contact with the phone of the person, say in the past, 5 days or 48 hours, it depends on the protocol. How the TCN, this code, is created and how the alert is sent depends on the architecture. And there have been, roughly speaking, two types of architecture: centralized approaches and decentralized approaches. I'm not going to go into detail about them because we don't have the time, but if people are interested, we can discuss them later. Both of them have a number of challenges that I wanted to discuss because I think it's very important to realize that this idea of using the smartphones is not exempt from challenges and limitations, and also not to make the debate too technocentric. I think we have to make it human-centric, and we need to understand the complexity of the problem that we are trying to solve. So one of the first observations is that we need a certain level of adoption, because if I have the app installed but no one else has it, my phone is not going to talk to anyone else's phone, so there's not going to be any contact trace, being created. There are obvious socioeconomic and demographic gaps because not everyone has a smartphone, and not everyone has a smartphone that is compatible with these apps. Bluetooth has a lot of problems because Bluetooth wasn't created for this. So it has noise, it's subject to interference, it has sensitive to ventilation, to the direction of the wind, it's sensitive to the environment. Also, the Bluetooth doesn't know how people are facing, if people are using masks, if there is a wall between me and the other people. So there is potentially a lot of false positives and a lot of false negatives. There is complexity around installing the upgrade of the operating system that would be necessary to use this app. And also globally, 25% of the smartphones are not compatible with a low energy Bluetooth standard. So there will be a lot of people that even if they have a smartphone, they are not going to be able to use this technology. There is also, of course, because its software is not invulnerable, it's also subject to people pranking it, to people putting phones in different locations just to create traces that don't mean anything, to do service denial attacks and so forth. There used to be an issue, this has been addressed by Apple with their API, but there used to be an issue with running this app in the background on the iOS devices. I don't think that's an issue anymore, but there is battery concerns, if the app is running in the background all the time. There are obvious security and privacy concerns because this is an app that a lot of people are going to have installed. If it has a security vulnerability, a hacker could potentially penetrate in a lot of the phones in a country, right, in a population. And again, we have to look at the big picture. The app is just one element. Testing and quarantine infrastructure are a must. These contact traces could be very large. If you don't have the testing infrastructure and the quarantine infrastructure, it doesn't help to detect all these possible infected people. Integration with the healthcare system is a must. If it's not properly integrated, it won't bring the value. Interoperability between regions and countries is also a must, because that's one of the reasons why we might want to use an app, to be able to track and create contact traces from people that move across borders. And as I said, the human-centric factors are absolutely necessary. How is the risk going to be communicated to the contacts? Contact tracers have a lot of expertise in communicating the fact that they were in contact with an infected person. How is the app going to do it? How are people going to react to this? I think all these factors are absolutely necessary. Just to mention, and at the European level, the ECDC published recently some guidance on the principles that the contact tracing apps should follow. And I don't know if I have time or I should leave it for later. I have a number of considerations to think about the apps, but maybe I can leave it for later. You
can go ahead.
Okay, perfect. Okay, so let's just go over some of the hypotheses and see if these hypotheses hold. The first hypothesis for contact tracing using apps is that a large percentage of the infections come from encounters with unknown individuals, with people in the supermarket or with people in the subway, right, or in the airplane, because those are the people that I don't know their name of and I don't know their phone number. So if a manual contact tracing is going to ask me, I don't know who they are, so I won't be able to give their names. But is this really the case? So we ran a very large citizen survey, and it's still running. It's called COVID-19 Impact Survey. It's 100% anonymous, and we have over 235,000 answers in Spain. We've been running it since March. Now it's been translated to many languages, and I invite you to answer the survey if you are interested, or even launch it in your own country. We'll be happy to partner with you on that. One of the questions that we asked in the survey was if people were positive or not with coronavirus. And another question was if they had had close contact with an infected individual that they knew. And we found that for 80% of the people who said that they were positive with coronavirus, they also said that they knew the likely source of infection. They knew whom they have given the coronavirus to them, because they knew someone with coronavirus in their household or in their friends or relatives or in their co-workers or their patients, or their clients. So the likely source of infection seems to be known. It is true that this was during confinement where people didn't have a lot of mobility. That percentage is probably lower now, but it's still a very high percentage. We've also been estimating with the survey the size of the contact tracers. And we find that for the vast majority of people, the size is around 4 outside of their household. So it's not super large. This is the percentage of people that report having had a close contact in the last week outside of their home. So as we see, 20% of the people say 1 to 2 people, 18% say 0 people, and then 3 to 4 say 19 people. So the median is around 3 to 4 people. But then we observe that there is 5 people that have basically 10% of the people have a huge amount of contacts. And when we look at the types of professions that they have, we find that they tend to be professions like essential services, health and social workers, commercial. So this is important because maybe we should think about strategies to tackle these professions that are very social, but the rest of the people don't seem to have a lot of close contacts, during the week outside of the household. Another question is, do we really need to trace all the contacts? So in the epidemiological models that we have built, we've done simulations from tracing 0% of the contacts, which would be this blue curve, to tracing 100% of the contacts, which would be this light blue curve. And we find that even tracing 40 to 50% of the contacts, we are able to flatten the epidemiological curve. So it doesn't seem that it would be necessary to trace, 100% of the contacts. Then we have the issue, as I said, of not everyone having a smartphone, having limitations with the app and so forth. So we thought about lower tech approaches to being able to scale and make it cheaper, to do the contact tracing. So we proposed this system called ECDC tracing, which is scalable, and it can be fully anonymous or not, depending on how you implement it. And it's basically a voucher-based contact tracing system. And this is how it works. The person is diagnosed with COVID-19, and then there are 2 options depending on whether the person feels comfortable sharing that information with their close contacts or not. Let's assume they do feel comfortable. So the doctor asks them with how many people they have had close contact in the past, say 48 hours or in the past week. And the person says, well, I've had close contact with 10 people. So the doctor gives them 10 vouchers to give to these people, and those vouchers are COVID-19 testing vouchers. So the person gives the vouchers to these people, and the people can use the voucher to get tested. So it's a way to sort of like decentralize the identification of the potential infected people. Another assumption from contact tracing is that all contacts with high probability of having been infected with coronavirus can get tested, because you want to know whether they are positive, and if they are positive, they need to isolate themselves, right? But is this really the case? I think it depends on the country and it depends on the situation. For example, in Spain, the purple bars show the percentage of people that their doctor told them to get tested, but there were no tests. And as you can see, at the beginning of the pandemic in Spain, the vast majority of people could not get tested. This has improved a lot, and now pretty much everyone gets tested. But this is a consideration that we need to keep in mind. Another interesting element is that citizen surveys can help us understand how the pandemic might be evolving. So we have developed a logistic regression model in our survey to automatically estimate the percentage of people that might be infected in a region, and to be able to do that in real time. So we have a sense of whether the infection, is starting to grow or not. Another assumption is that all contacts that are positive will be able to isolate. Is that really true? Well, in Spain, we find that is not really the case. Around 40% of the people report that they would not be able to isolate if they are asked to. Why? 24% because they share a home. 14% because they have to take care of someone. 7.5% because of professional reasons, because they cannot take time off in their jobs, or because they would not be able to eat if they don't work. And 9.4% because of psychological and social factors, because psychologically they cannot see themselves confined anymore, or because of fear of stigmatization by their community. So this is very important. We need to help people isolate. Otherwise, there is no point in finding, them as suspicious cases of having COVID-19. So just to wrap up, what are my take-home messages? I think my first message is that manual contact tracing, if it's properly scaled, and if it's using digital tools that would enable the very fast analysis of the data collected by the contact tracers, might be sufficient. Mobile apps can be of help, but we need to address the limitations that they have. One of the most important elements for apps, from my perspective, is the close integration with the healthcare system, and also interoperability between apps in different countries, because these are some of the reasons why we might want to use an app. Non-digital tools like citizen surveys and ECDC tracing can also be interesting to think about. We do need the ability to test the suspicious cases, because otherwise, why are we trying to, to find them? And we also need to provide quarantine infrastructure. We cannot ignore the fact that a percentage of the population is not going to be able to self-isolate. I think it's very important to protect the elderly, to have an absolute control in nursing homes, and to provide special measures for healthcare workers, for essential services workers, have separate areas in hospitals. For example, hospitals have become a breathing area for outbreaks of COVID-19. And I think also it's important to take considerations in highly social professions like retail, and hospitality, and in locations where we know that become sources of outbreaks, such as food processing plants, meat processing plants, public transport, indoor offices that have no ventilation, and so forth. And with this, I just wrap up my presentation, and I'll be happy to ask questions in the discussion. Thank you.
Thank you so much, Nuria. That's like a whole lot to digest, and it's extremely interesting. I thought I had some knowledge around contact tracing, but I've learned a lot more. And there are a lot more questions I have, but I just want to hear from all the panelists, then I will start pushing out my questions. So at this point, I just want to bring Felix in. And Felix, you are more of a technical person. And so I just want you to address this topic from your perspective as a technical person. What do you think should be the best approach to doing this? Because we've seen that contact tracing is definitely happening with technology, and we need the technical people, the engineers and the computer engineers, the software engineers and the like, to come up with these contact tracing apps. So please tell us from your perspective, what would be the best approach to doing this? And before you go ahead, I just want to note for our audience that we have some polls there, so it would be interesting. Would love for you to take time off every now and then to respond to the polls whilst the conversation is going on. Felix, I give the stage to you now. Thank you.
Yeah, Dr. Nuria, that was explosive. I mean, hey, I have probably learned a lot more than Teki has learned. So that was quite impressive, and thanks a lot for all of that information. What I will attempt to do, and that's going to be kind of difficult, what I will attempt to do will be to add a little more to what you've just told all of us, and give us some ideas about what I think we should be looking at in terms of the context when it comes to contact tracing, especially with regard to this part of the world and what our experiences have been. So that will be my focus for now. And actually, as you were speaking, I took out those slides that more or less repeated what you had to say, so that I wouldn't have to repeat your angles again. So here we go.
From
a contextual perspective, like you rightly said, Nuria, the legal framework governing the tenets of the solution or approach and respect for local laws and international laws and conventions is important. It's very key that before you build an application, you understand the rules and regulations that govern that application. Okay. Secondly, public health agencies implementing the contact tracing for COVID-19 should be prepared to communicate how information will be used, stored, and accessed, and how individuals will be protected from harmful disclosure or identification. This necessarily means that whenever you're building the application, this tenet you should be guided by this tenet. How are you going to protect individuals from harmful disclosure or identification, for that matter? We also want to look at the level of technology adoption, which in our case is mobile telephony penetration and smartphone penetration, just like Dr. Nuria has mentioned. And in this part of the world, this is closely related to literacy levels. You can't ignore the context within which the application is being built. And mind you, one of the first things that I should have mentioned is, typically, just like Nuria has mentioned, we have the international perspective, the global perspective. But in the initial stages, each country went into its own lockdown. Each country protected its borders. And therefore, the response was in-country. Okay. And therefore, if anyone is building an application, that application has to take into recognition the in-country nuances as against the global nuances. And therefore, local context is very, very critical. Okay. Now, what are the main building blocks? I've tried to make this as untechnical as possible so that we can all get along. When we get into the question and answer session, I can be a little more technical. But from a helicopter perspective, before you build the application, you should understand that there's the need to segment the population. Basically, one approach does not fit all. Okay? We have manual approaches, we have digital approaches, and the different approaches will work for different segments of the population. And as a matter of fact, with respect to the digital approaches, just like Dr. Nuria said, we have different segments within those who are digitally enabled. There are those who just own feature phones and therefore cannot take advantage of the apps that go with smartphones. There are those who own smartphones and therefore can benefit from the apps, etc. So at the end of the day, the most comprehensive approach to the contract tracing conundrum is probably to have a combination of the manual approaches and the digital approaches. However, even when you're doing the manual approach, you should have some back-end capability to stop and analyze the information to help you with your decision making.
Felix, not to interrupt you, I just want to welcome Judaisha. Judaisha, you are live now. I just wanted to say welcome. and let you that you are live. For all the speakers, kindly mute your microphones whilst you're not talking so that we don't get any of the background interactions whilst the speaker's on. So sorry, over to you. Yeah, Felix. And then Rudesha will come back to you after.
Okay, I think I've slipped one slide. That's okay. Welcome, Rudesha.
Welcome to you all as well. I've been having some hiccups with the system, but finally it's working, and extraordinarily all we are together here, so I'm very happy. And nice to meet you, Nuria. I guess we've met before for UN Global Pulse as well during our meetings, and thank you. Please carry on. I will join you as soon as your presentation is over for questions and for my own presentation. Okay,
That's fine. That's fine. Okay, so as I was saying, typically in this situation, and it's different for different stages of the pandemic. In the initial stages, all the countries are on lockdown, and you only having to deal with in-country situations. Therefore, you have your application, whether you're using a digital application or a manual application, has to take your local cultural nuances into recognition. Okay, so the major consideration in all cases when it comes to the data protection side of things is the user experience. If you remember, one of the guiding principles that I mentioned in the previous slide was that at all points in time, when you're using a digital platform, the user or the potential patient needs to know that you are soliciting for information, needs to agree that he or she gives you the authority to solicit and keep that information, and needs to understand how that information is going to be used. So at any point in time that perspective changes, then within your digital application, you should have a prompt or a bit of information that says, yes, mind you, do you agree that we store this information, or these are your rights within the application, depending on the kind of information that we are collecting. Having said that, we also, just like Dr. Nuria mentioned, the data analytics in a real-time or near real-time capability is critical. All of this data that is being collected, how is it being stored? Is it structured in such a way that it can be analyzed and used effectively? And timeliness is important. You can't have a situation where you have data scientists, forgive me, data scientists, I'm not referring to you. You have data scientists who take their time to come up with inferences about the data that has been given to them. We have to be ahead of the data. So once we've collected the data, the experts need to be able to point us in the right direction as to where the virus is going, at what stage of the pandemonium are we, and all of that, so that we can have the effective management. Dr. Nuria, I'm sure you are familiar with Go Data.
Yeah.
Which
for
is
the
the
World Organization. Yeah.
World Health.
Yeah, that's when I meant that the contact tracers need to have access to digital tools. That's an example of a digital tool that would enable a fast ingestion of the data, and the analysis of the data. But it's not the case in many countries. They have legacy tools. They have really old-fashioned tools to enter the information that makes it very difficult for the data to be used immediately.
Yes, and that in itself points us to one other issue, which is, and you mentioned that the need for more global harmonization in this approach. I mean, yes, the initial approach was country specific. Every country was doing what it thought was right. But I think we've gone past the stage where we need to be overtly nationalistic. We're in a global village. We can't subsist by ourselves, and therefore, whether we like it or not, air travel will soon start at some point in time. Land and sea. I'm just doing some work at the Ghana ports, and imports, exports are still going on. Okay, so there's movement of goods and movement of produce. All of that has to be taken into account when we are building these platforms. So we need to go beyond being country specific to a more harmonized global approach to these apps that we are building. Nuria, yes, you did mention the constraints. Let me just emphasize them again. Financial constraints, technology infrastructure. The technology infrastructure in each country is different. I mean, for some of the African countries, we still have fairly basic infrastructure, and therefore a lot of these concepts will be difficult to put in place. What do we do? How do we combine the less intensive or less expensive methodologies and less expensive infrastructure with the capabilities of these countries? Which is why I still insist that we need a more global, harmonized approach. Okay. Then you also mentioned the human side of things when you're talking about the constraints. First of all, you've got to be able to have the tracking and tracing teams. They have to understand the apps. They have to understand how to use the apps. Okay. They need to be able to send the right kinds of data in a centralized system. They need to send the right kind of data to the central repository so that we can analyze that data, so to speak. Okay. And we should also note that as the numbers increase, okay, it becomes more and more difficult to utilize the purely manual approach, because then you have to have masses of tracers going out, following the contacts and getting the contact details. Where does it end? If you've not been able to flatten the curve or not been able to get it coming down, then you're going to be needing an exponential number of tracers continuously. And the question is, where does it end? How do you then manage the situation? In a lot of African countries at the moment, we are seeing the numbers steadily rise. And we know that the contact tracers are under severe pressure. So the question is, what do we do? Okay, that's a question that I think we can all discuss as we go forward. All right. Okay. Nuria, you mentioned the MIT website. I went there and it was chock full of information on initiatives that are being carried out all over. And if I was to go into detail again, I'll eat into too much into the time. But I will encourage everybody who's on this webinar to visit that site. We'll make the notes available. We'll make the recording available. Techie, you've mentioned that. And you will get details of all the initiatives, digital initiatives that the various countries have started. Okay. Let me just say that early this morning, I was watching CNN, and Bill Gates was being interviewed, and he actually said that, you know what? Yes, these apps are good, they are helping, but they haven't helped to the extent that everybody expected. So perhaps there's something that we need to do better. Okay, and that's a question that goes to all of us. What is it that we are doing that we need to do better of? The good thought that we are doing that we need to enhance. We've got to think through, because the restrictions and the constraints when we use smartphones are hindrances to progress. We need to be able to do something that is easier and cheaper to manage. Do we use wristbands, IoT-enabled wristbands? Do we, what else can we do? There's a whole lot of capability that we need to think through, but we definitely need to get a grip of COVID, and we need to enhance what we are currently doing. Okay, hang on just a minute. There's more stuff on the various countries. I noted very happily that Ghana was right there. If you look towards the bottom, Ghana is third from the bottom, and this is what our app looks like when you try to install it. I won't go into the details, but basically it's more of a self-service thing rather than make it complicated. And I like the fact that this approach was used, because 3 days ago I was listening to one of the local radio stations, and there was this fellow who was just praising this app because of its simplicity and the fact that he didn't feel well. All he needed to do was to download the app, and when he entered his details about how unwell he felt, he was contacted and tracked and given medication and attention, self-isolated, was isolated for 2 weeks, and now he's back up, which means that if we try to keep it simple and not too complicated, we can get some results. Okay, so let's try to rework and rethink about how we can keep things simple and less complicated so that we can get the data that we want. Okay, so in conclusion, digital contact tracing will always or should always complement the manual contact tracing, okay, and a comprehensive project management approach. I'm a project guy, so forgive me, I had to slip that in. That is what makes me happy. But life is all about project management. Everything we do, setting up this webinar was a project. It's all about how we manage the projects that we have to attend to. So in my view, putting in place a comprehensive project management approach using a complement of health, digital, analytics, and other requisite experts, harmonizing them properly is what will get us the desired results at the end of the day. Demographics and appropriate segmentation should also inform the approach. Like I said, one shoe size doesn't fit all. What happens in Senegal is different from what would happen in Singapore. We can't. The two approaches would and should be very different because contextually they are different contexts. However, we should be aware of what we are all doing so that at the end of the day, we end up having World Health Organization ends up having a global picture and is able to give better direction as to where we should go. And underpinning all of this is that every step of the way, whether you are developing a digital app or a manual operation, from a project management perspective, the tenets of confidentiality and privacy need to be respected and balanced with the data collection, storage, and analysis requirements. I'm quite confident that one way or the other, we will win. So I'd like to end my presentation here for the meantime. We'll take questions and answers after the next speaker.
Yes, thank you. Thank you very much, Felix. Judesha, are you ready for us? We're coming to you now. Judesha, are you ready?
Yes, I am.
Yes, thank you. Thank you very much, Felix. This was also very comprehensive, and I like that you simplified it. for us, but I'm sure there are a few technical people also on the line, so maybe they'll throw out more technical questions to you on how to approach these. Judesha, I am quite interested in what you want to say, because one of the biggest concerns about the COVID tracing apps that we've had, or maybe let's call it the biggest debate in all of this, has been the fact that privacy and data protection has to take a backstage, because this is a health and safety issue, and there's the privacy and data protection. I also know that you have worked closely with government in almost eliminating or managing the COVID in Mauritius effectively. I would like to hear from you as a data protection and privacy regulator. What do you indeed think is the best approach to contact tracing? And especially if you can, focus on
Uh-oh. Hi, it looks like we've lost the moderator for a minute, but okay, Teki, are you back?
Oh, you lost me. Sorry.
Yes.
Wow.
We lost the final words, actually.
Sorry, so sorry about that. So I was saying that the challenge that we've been facing in all of this is more or less people are talking about a trade-off between privacy and data protection and health and public safety. So I want you to throw more light on what would be the best approach. Also, especially because I know you worked, Mauritius have almost eliminated COVID from the country, and I know you work closely with the government. So what did you do there? Is this an issue of a trade-off?
Okay, Teki, first, I'm very happy to be here, as I said before. But can you please tell me why you're not allowing me to share my screen for my online presentation? Actually, I'm blocked, so I cannot share my presentation with you. I
believe Backstage is working around that. I do not know why it's unable to. Okay. Yeah, but Backstage will be working to ensure that happens, and we'll alert you too.
Yeah. Otherwise, I will be doing this
presentation. Drew,
slides.
Can I interrupt just for a second? Perhaps what you could do is, if you could send one of us, either taking myself or Nuria the presentation by email, then we could quickly put it up.
So you already have it. You already have it, Teki. They already have my presentation.
All right.
Okay.
Just put it on screen. That's what I asked, so that you can at least follow the presentation. Don't worry about going fast on it. It's just what the content is, so that you actually can follow. But I can't.
We'll do that.
Yeah.
Okay.
So I definitely, your question is relevant because my presentation is focused on your specifically on the question that you have addressed. And if you would allow me, before I go into depth into that question, just let me introduce what Mauritius has been doing with regard to COVID-19. And I will carefully not go on the different techniques of contact tracing that has been elaborated before by our two wonderful presenters, so that we save time and we don't go on the same issues again. So let me just tell you what this office has contributed, has done in the context of the pandemic. So at the very outbreak, when the pandemic just started around the world and in Mauritius, we came with what was termed the regulations enacted under the Public Health Act. And we actually collaborated on the drafting of this regulation to make sure that there are sufficient data protection and privacy considerations incorporated in the process of contact tracing, screening, assessment of patients, rights of patients. So what we did actually was we introduced many sections in the regulations. I will briefly go on them because I think they are worth mentioning. For example, what types of information could be collected from a patient. We applied the data minimization principle in that context. We made sure that only the most important and relevant information was being gathered and collected from all the people concerned, including those who were not infected, stricto sensu, but those who potentially could be with the virus. So name, for example, the contact details of the person, which are the basic elements of any individual. We started with that information, and then we went on the travel history details of the person, which are relevant in the context, and subsequently the health data of the person, that is biological samples, biometric data, etc., genetic data, wherever it concerned this particular virus. So we actually rested our case here with regard to what types of data could be collected from the individual, and I guess it worked because not all the information of the person was collected and stored. So this is the first point I would like to throw, and how we actually started the screening assessments of people infected. And then we went on to say that we need to apply the concepts of necessity and proportionality whilst a medical practitioner is actually handling a patient. What we meant by it is that any restriction that the doctor could impose on his patient with regard to his own safety and medical condition had to be necessary and proportional to the aim that had to be achieved with regard to that particular circumstances, which already meant that incompatible collection of the data for other purposes not related to this situation was not possible. So that was the second purpose limitation that we actually, in principle, that we introduced in this particular regulation. So by law, we already had these principles in our law, in our regulation. And then we went on, we added another section. Yes?
Yes, Judesha, we have your presentation.
Yes.
I think Felix is helping share it now.
Oh, thank you so much. But I can't move it. That's what if you can just go through it, it doesn't matter whether.
Because to be able to control it, you had to share it. You know, it should have.
But I can't.
Now, yes, this is being shared by Felix, so he would have to control it for you.
All right, Felix, you have my thumbs up. Please do it on my behalf. It doesn't matter whether it's actually following my discussion, but just go slowly one by one, please. You would help me a lot on this. Thank you. I can't hear. Yes. He's been muted. Yeah.
You're muted.
Okay. Sorry, just give me the thumbs up when I should go to the next slide, and then I
All
can
right.
go to the next slide.
Great. Thank you, Felix. Thank you so much. I don't understand why this is happening. I'm on my iMac, probably that's why it creates problems, because iMacs always have problems. So I guess this is the situation right now. But so let me yeah, you could go on to the next slide. But what I'm actually doing right now is giving you a purview of this particular regulation that I've been talking about. So I was on the right to be informed of the patient, which is another legal criteria that has been actually incorporated in the regulation. So when a person is actually quarantined or isolated, the reason for him being quarantined, what are his rights when he's being quarantined? What are they going to do with him during quarantine or isolation are actually all incorporated in this regulation. I think at that time, we're talking about 3 months back, that was a wonderful start. Just to make sure that you see, because what we were talking about that time is only security, health considerations, and who would actually bother about privacy rights or even human rights in general. That wasn't the prime consideration for nobody. The prime consideration was just to contain the virus. But at this particular point in time, we already had these privacy considerations in the regulation, and the regulation was followed, and it's actually of a very serious nature, because any infringement or violation of this regulation amounts to an offense. So if you don't inform the patient, you are actually, or the Ministry of Health, the medical practitioner is committing an offense, and you could be prosecuted before our courts. And it is still valid. The regulations are actually still valid up to the time that the virus will exist. It's not been revoked yet. So this is the law right now. So we started actually with this particular regulation under the Public Health Act, and then we went on to have a comprehensive COVID, what we call the COVID-19 Miscellaneous Provisions Act. And this particular legislation on COVID-19 meant that any legislation concerned with the virus would be actually amended or updated to make sure that the situation is under control in our legal frameworks. One of the legislations that were actually amended is our own Data Protection Act. And this particular amendment related to when a public authority is issuing a license, a permit, or an authorization under COVID-19 period, for example, to displace, to move, to go to work, or to even have a commercial enterprise, we needed permits to do that during confinement because we were not allowed to move. So that particular exemption from the DPA was allowed after consultation with our office because it actually didn't bother the privacy rights of people. What it meant is that just for the issuing of a license, the police commissioner had the authority to do it, but without having to inform the person of the principles in the Data Protection Act, which was a cumbersome procedure, we must admit. So we allowed this particular emergency provision to be made so that these permits could go very fast, so that everybody concerned could be issued with licenses and that they wouldn't be bothered in their daily lives. That was a practical consideration where you could see that sometimes data protection considerations have to be trumped over, between inverted commas, because it's not always possible to have all data privacy considerations in that particular period. What we are happy about is that actually the Data Protection Act applies. It has not been suspended, and we actually, I'm working right now, so we are giving advisory opinions to all people concerned, and data privacy considerations are being respected. And to just wrap up on the legislative and advisory roles that we have undertaken, we came up again 2 months ago, since April, on a guide on data protection. As you can see here, a guide on data protection. It's on our website as well. And what we actually I will briefly go in this guide just to tell you exactly how we have been using data protection principles in Mauritius in the context of COVID-19. Basically, all what I'm saying is not in the presentation, but that was meant to be the case. I wanted to discuss more on the legislative framework, and this presentation can be used for the purpose of the participants and the other peoples. But it's good that we are having both at the same time. And so I will briefly relate to you what actually we have put in that guide, and it has actually worked. It has given its fruits already, because in the private sector, including the public sector, they are actually complying with this guide, and we have been effective in the sense that we didn't have to go and talk and because it was not possible to do it, to do training, to educate the people, to sensitize the people on their rights. And this guide has been highly, widely communicated to all people wherever we could in Mauritius, so that they could see actually how they need to protect themselves during this particular period. And what we actually said is that we have identified what are the lawful bases for processing of data in this context. We have several sections in our law which highlight how processing of personal data can be possible even without the consent of the person, coupled with the legislative framework that we have. We have other exceptional situations: public interest, legitimate interest, vital interest, as you probably know, and I won't go too much into these details because I guess all DPAs around the world know these principles. So we have the same principles based on GDPR concepts in our legislation. So we actually used these sections to actually help, for example, the Ministry of Health to be able to collect data, which was very important, at the same time protecting the rights of people. So I would briefly also tell you what actually we have been doing in the context of how we have applied these principles. We have made this guide in a way that is very practical. That is, every word in this guide can be used. We have put the focus on the data minimization principle, on transparency, the appropriate security controls that have to be in place for an organization to handle apps, AI solutions, contact tracing solutions, including manual and centralized versus decentralized storage of data. All these have been already monitored by this office. We have audited one particular circumstance where data was being stored, and we have actually advised on how this storage was to be done. So we've been working quite a lot in the sense that we actually have followed many organizations in their process. Whereas on AI, actually, we have been following what the world has been doing. I guess this is a bit of everywhere in all countries, that actually we are following the pseudonymization techniques, the time limitation, as I said, all the principles that have to be followed in order for us to be able to meet international requirements as well. Because we shouldn't forget that also being part of the Convention 108, we have obligations under the Convention 108, and we are following all the principles that the EU is adopting. And in Mauritius as well, we are closely monitoring the situation. So as you can see, it has been not really a trumping over of privacy, of national security over privacy. It has been a balancing exercise more in our context with regard to these prevailing considerations. So I'm quite happy to say that we have reached a stage where actually, as Teki said, we have almost eliminated the virus, but now the problem remains with the opening of the frontiers. That is another issue that we have to see whether actually we will eliminate it or we will reintroduce the virus in the country. So this is something that we all scared of and we don't want it to happen. But for now, we have been able to approach many instances where we are actually gathering information, making surveys as to how they are being able to actually control the virus. And it's a wonderful situation for us. I know it's not for everybody in the world, but we are quite happy that we have been able to work all people together to ensure that we have reached where we are. Unless you have other questions, I will stop here so that I don't, I haven't finished the presentation. It doesn't matter, but I guess that was my main consideration that I wanted to share. You're welcome.
Thank you. Thank you very much, Judesha. Sorry about the presentation. We thought our earlier interactions with your team would have sorted all those things out. This is our new normal now, and I have decided that I'm staying away from sharing slides during this COVID, and because it's been, my experience with it has not been too good. So I'm not very touchy with it. I need to, learn a bit more. But this has been very informative. And before I go, we have just a few minutes to go. But I have so many questions for all of you. And I just want to start on, and this question goes to all of you. I just want to start on a controversial note, right? So COVID-19, more or less, is a pandemic. It's a national health issue. It's a public interest issue. Is it necessary, to have consent of anybody who wants to, for instance, use an app, or whose information you need to collect for health and safety reasons? Do we need their consents, or should we just go ahead and collect whatever we need to collect? I think that, ending on that note, maybe Judesha, you come in, and then I'll move to Felix, and then Dr. Nuria Oliver.
Yes, great. Actually, I answered your question, but I'm happy to highlight more on this particular point. It's very, very important that we know that consent in any situation, just forget only about COVID, consent is just one of the lawful grounds in data protection which allows for processing of personal information. We have many other grounds that we can use to actually process data. This is in the normal context in any way. So now during the COVID situation, if somebody comes to say that consent is mandatory, that would be a fallacy. And we shouldn't actually allow even for this to, even if we are the most fervent data privacy advocate, we shouldn't say that consent is always important here. And if you've seen what the approaches made by the Council of Europe, they have spoken about the concept of voluntariness, and that is to be distinguished from the concept of consent. Voluntariness doesn't mean that you need the consent of the person. So that is something I don't want to, but it's in my presentation, you will see it. The concept of voluntariness relates to the fact that any of the grounds that you have in law which allows you for processing to be made, let's say public interest, let's say the vital interest or health interest of a person, or the legitimate interest of a controller, or any other, or a contractual obligation, or a legal requirement in law, all these allow for processing of personal information in any way to be made, such that consent is not always obligatory. So that's what I wanted to highlight. We can't hear you. We can't hear you. We can't hear you.
Muted myself, sorry. Yeah, Felix, so can you hear me now? Yes, yeah. Felix, so I was saying that, should we just get up technology, an app, even collect whatever we need quietly in the background, even when, we are not deliberately putting on the app and all of that?
I think that under the circumstances, look,
Felix,
it's that when these things happen, we are not in normal times, okay? But even though we are not in normal times, you have the health authorities, you have the regulatory authorities, under whose arm and gambit we are supposed to operate. So I think that at the barest minimum, there should be a process of authorization coming from the regulatory bodies that are in charge, saying that, okay, we recognize that you have a certain ability or capability that we can use, that is useful during this pandemic. And therefore, you can collect this data, or you can deploy this app to collect the data. I think if we left it wide open, we would have an army of, cowboys in there, doing anything and everything. There has to be some amount of guidance and quote unquote regulation of the non-regulated regime that we are trying to put in place. I think just so that we can manage things properly. That would be my response.
Thank you, Nuria.
Well, I'm not an expert in the law, but I can just share some thoughts. Indeed, a situation of a pandemic where lives need to be saved and where individual freedoms are halt, for example, freedom of movement, right? When a population is under confinement, right? It's a very different situation than some sort of like normality. And I think one of the risks that we face is that intrusions into people's freedoms and rights that have been made during extraordinary times remain after the extraordinary times. So I think that's one of the concerns, and that's something that we might be observing in some countries in the world where this has been used as the Trojan horse for eroding some of the individual rights, right? The other observation is, in principle, when they talk about voluntary in Europe, is that they are not going to do a forced download of any app into every single smartphone that happens to be in European, land. People will have to decide to install the app. So there is a clear, obviously, if you install it, it's because you consent to install it, because you are deciding to install it yourself with your own hands and your own, which is not the case in some countries where there is a compulsory request for installing some of the apps. Right now, the situation in Europe is a situation of voluntary use of these apps, for example. What type of data the apps capture? I think they apply the criterion of data minimization, but at the same time, the app has to be useful. I mean, we talked a lot about the limitations, the technical limitations, but it also has to collect the minimum amount of information useful for the app to actually bring any kind of value, if it's able to overcome the limitations that it has. But I would say the biggest concern, I would imagine that most people would realize that exceptional circumstances grant exceptional measures. Where the debate comes to place and where the concerns come to place is what happens after the exceptional circumstances. How we're gonna go back to the way we were. Are we really gonna go back, or have we lost something, permanently because of the exceptional circumstances?
Yeah, thank you, Nuria. I think you are really echoing the concerns of many, which is why sometimes I like to maintain the fact that, and to echo what Rhodacia said, it's not about the suspension, especially when it comes to fundamental rights. It's not about the suspension. I like to say it's about synergy, because these fundamental rights equally recognize these emergency situations and how they should well be handled. But we have a question here from Emmanuel Mugabe, and he's saying, on the waiver of the obligation to information, the data subject about their rights during the issuance of movement permits, where compensating controls still implemented on the security measures to protect the privacy of personal data. I'm a bit lost on the understanding, but I don't know whether Emmanuel, if you're still online, kindly rephrase your question more simply, but I will throw it to my speakers, able panelists. Maybe you have some clarity. I think he's talking about the data subject rights during, movement restrictions and all of that, and what kind of rights they should have, especially, within the context of the pandemic.
Well, I mean, if I interpret his question correctly, I mean, I think there are two elements in the context of restriction of movement and confinement measures. Aggregate, anonymized mobile data has been used to quantify large-scale mobility of a population. Both data captured by the mobile network infrastructure, by the cell towers, and also data captured by smartphones, like Google and Apple, for example, have published, changes in the mobility, aggregate and large scale, and therefore non-personal, data. There are examples of personal monitoring of people's whereabouts for example, enforcing quarantine measures, and this has been used in different countries in the world, where an individual location is being monitored in real time, and notifications are sent or fines are given if the person gets out of their home or gets out of where they were supposed to be. And that's a completely different scenario, where there is an individual analysis of personal data, and there is also an individual monitoring and restriction on the individual's, right of freedom of movement, right? So I think it's important to distinguish all these different elements when we talk about, data or movements. Are we talking about large scale data, aggregate data, non-personal data? Are we talking about individualized, data about a single person, that is being monitored?
Thank you.
If I can just yes, in the Mauritian context, actually, the concept of anonymization has been applied quite completely. What I mean to say is that no names of no patients have been communicated to the public, and this is also a legal requirement in the regulation. Nobody knows actually who was infected with corona and who was not infected. That only the Ministry of Health had restricted access to this information. They were the custodians of that data, and this data couldn't be circulated to any other people who were not authorized to get access to. So that is something in itself which shows that if the data is completely anonymized, then the issue of it being infringed by any other party couldn't even arise, in the sense that they don't know actually who are the people who are infected, and there was no discrimination which could be done towards these patients by the public or by third parties, because no one knew actually who was infected.
Thank you. Felix, do you want to react to that?
No, I think Judacia and Nuria have very elegantly reacted to it. I'll let it pass. Not much to add. I'll only be repeating what they've just said. So
very well. Very well.
I just wanted to add another dimension that we haven't discussed, and that I consider is absolutely fundamental, which is the concept of trust. Trust in the institutions that are the agents of the measures, or that are the promoters of the technology that is being used. Trust in the technology itself. I think if there isn't a relationship of trust, none of this is really possible. And we are seeing some social unrest in some countries, partly due because of the mistrust in the institutions, or in the system, or in the apps. So how to ensure that trust is pervasive, I think, should be a priority. To have trust, three conditions need to be met. The first one is the condition of competence. That is, you need to do well whatever people are trusting you with. So if they are trusting you with, saving lives, you need to show that you're saving lives. If they are trusting you with, their data, you need to show that, they're doing something with the data, you're treating the data correctly. The second one is reliability, which is competence sustained over time. So it's not good enough just to do it well once. You have to sort of have a track record of doing things well, over time. And the third one is honesty and transparency. And I think the first one, maybe the competence, and the last one, the honesty and transparency, has been lacking in many countries during this pandemic. And I think that has made it difficult for people to trust the institutions or the policies or the technologies that have been used.
If I may just add
Yes.
one word on trust and all the notion that Nuria has just been saying. This is, I would say the beauty of the work that we as data protection regulators do. I think it's how we actually ingrain these principles in our books, in our daily lives. And that's what we did in this regulation. This is why I took the time to go on this regulation. You will see that the concept of trust is in that regulation. How is it in that regulation? It says that the medical practitioner, for example, has to trust, the patient has to trust the doctor when he's giving his information. And the doctor has to trust the patient when actually what type of information is being gathered from that patient. All these are elements of trust. Competency obviously is also involved when you're dealing with competent individuals. Transparency also. So this is, I think, the beauty of data protection and privacy principles, is how we juggle with them and how we incorporate them in many, many scenarios. I just wanted to.
Wow, thank you very much. This is so exciting. And we have one more question from Emmanuel from NITA in Uganda. And interestingly, NITA in Uganda is also implementing the Data Protection Act. His question is to Judesha and Felix, and Nuria, you could chip in if you have any responses. It said, how have both Ghana and Mauritius met the requirement of the data subject's right to access information on personal data collected during the tracing process? So, Judesha, maybe you could start there.
Yes, definitely. That's a very good question. Thank you for the question. Actually, as I said, the Data Protection Act has not been suspended during the pandemic and is very much in force right now. So we have a particular provision on right of access, and it's applicable, which means that those who want to get access to their medical history or any information relevant to them, they can get access to this information. There is no barrier to getting access to their information. So that is something which is very, very, I must say, very reassuring for people who would like to know how their information has been handled, who had access to that information. And this is, in our case, it is possible. So there is no restriction on the right of access.
Okay.
And secondly, if I just forgot that point, I think it's also relevant to add it. We have, as in many other European countries, suggested, because we're dealing with high-risk operations, a data protection impact assessment has been recommended in many instances, which means that all these rights that we're talking about actually are given importance and are being respected. Thank you.
Okay, very well. And then, Felix, do you want to react to that? You're mute.
That what happened in Ghana in the initial stages when the symptoms, I call it symptoms reporting rather than contact tracing, app was introduced. In the initial stages, there were some issues to do with where the data was being stored and the manner in which it was being stored and who could have access to it. So what essentially happened is that the attention of the government was drawn to the loopholes, and they ended up doing, I think, 3 or 4 updates, which sought to block those loopholes in terms of who has access to what, and to align it properly to the data protection tenets that we have. So it was a metamorphosis, basically. The first cut that came out, of course, everything was done in a bit of a rush because we were all in a hurry to try to stem the tide. But now it's been properly aligned. So subjects actually do have access to their own data, and there's a whole stream of rules and regulations around how that data is accessed and used.
Yes, thank you very much. Nuria, do you want to react to that? I just want our audience to know that you will be leaving us in the next 5 minutes. But there's one question to all the panelists that I want to throw to you first, Nuria, and then you can give us some closing remarks before you drop off. The question says that, wow, where have I? Okay, what approach can you recommend to countries that are still struggling with the traditional contact tracing and still don't have a sound data privacy policy in order to properly implement an innovative contact tracing solution? So Nuria, maybe you can start with that and give us your closing remarks, and then we continue.
Maybe they are good candidates for the ECDC tracing idea that I shared, where you can scale it. We can scale the contact tracing easier because the tracing is done by the people, themselves, assuming there is a country where there is a high level of stigmatization regarding COVID-19. I think the priority, I think there are multiple priorities that could be done, or multiple fronts to attack. We know that the impact of COVID-19 is significantly worse on people, on the elderly, on people with risk factors. So I think special measures can be taken to protect them, because by protecting them, we can actually avoid a lot of the deaths and a lot of the intensive care units. In the same way, it's important to protect essential services workers and healthcare workers because they are exposed to the virus. They are essential for fighting the pandemic, and we want to make sure that they will be healthy. Also, hospitals need to take special measures to avoid becoming breathing areas of the virus and transmission areas, as it has happened in some countries. And if there are nursing homes, definitely taking special measures in nursing homes, which have also been a big source for outbreaks and deaths. So protecting the most vulnerable could be an important strategy, particularly if there isn't the resources to properly do contact tracing, assuming that if the virus behaves in the same way as it has behaved so far, having the youth and having the young population get the virus, if they don't infect the elderly, if they don't infect people with risk factors, in principle, they would need to stay home and and overcome it. But in principle, they wouldn't need to go to the hospital. At least statistically, that's how the virus works. As I said, trying ECDC tracing could be quite interesting, and I'd be happy to follow up with that, and we could try to do a pilot. Communication campaigns to society, I think, are very important. We need to understand that COVID-19 doesn't become a pandemic if we don't want for it to become a pandemic. We are the ones that are spreading it, as we move around, as we touch other people. So it's not the government, it's not something external to us, it's each of us that are actually contributing to having a pandemic. So the responsibility and the behavior of each of us can have a huge role, because if we all behave as responsible citizens, we can actually help mitigate the impact, right? So communication campaigns, I think, are very important. So people realize that they are the ones that are actually spreading it, each of us, that, wearing masks or taking precautions, making sure that, you wash your hands is very important. And then we do know that there are certain environments that are the likely sources for outbreaks. And in English are environments with the 3 C's. Environments that are closed, so indoor environments that have no ventilation are areas of high probability. If those environments are crowded, so if there is a lot of people and there is close contact between the people. So we have food processing plants, we have slaughterhouses, we have public transport where people are, for a long time together. We have offices that have no ventilation, and there are a lot of people in the office, factories where people are all together without any kind of ventilation. Those kinds of environments, we know that tend to be the places where there are outbreaks. So let's take special measures, in those environments as well.
Wow, thank you, Nuria. Do you want to stay with us for a few more minutes, or you want to give us your closing remarks and leave now?
Well, I have to run, unfortunately, but thank you for the invitation. I think it was a very interesting and lively discussion.
Amazing. Yes, and thank you very much. I think before you drop off, I just want to share some of the poll results, and then I'll get back to Judasha and Felix on their reaction to the earlier question. Interestingly, we asked, would you use contact tracing app? The 26% of those that responded to the poll are undecided. 26% said no, and then 47% said yes. Do you trust a contact app to protect your privacy? 26% were undecided. 63% said no, they do not trust that contact tracing apps will protect their privacy, and 11% said yes. Now, on the question of, do you think your country's, sorry, can you hear me?
Yes.
You can, okay. So on the question of, do you think your country's data protection regulator has been effective in safeguarding data protection and privacy rights in the era of contact tracing? 0% said that does not apply. 37% said they are undecided. 53% of those that responded to the poll said no, they do not think that the data protection authorities have been effective, and 11% said yes. On also the question, just a minute, I think, Nuria, you can leave us. I'll bring the rest of the poll results in later. And Judasha, thank you very much.
Bye.
Judasha, yes, bye. Hi, and sorry about that for those of you who got logged off. We got logged off accidentally. Yes, and Felix, maybe I should get back to you to respond to the question that had earlier come into the panelists, that what approach would you recommend to countries that are still struggling with traditional contact tracing and still don't have a sound data privacy policy in order to properly implement and innovate contact tracing?
Okay, thanks, Teki. I think that if you have come this late to the party, then you have the advantage of all the others who have experimented and tried solutions, and you have the advantage of seeing the results of those solutions as well. As you can see, what happened in Mauritius was exemplary. Okay, and there's expertise all around. So I would say that rather than try to reinvent the wheel, because you need to get some traction as quickly as practically possible. I think you want to take a look at best practice, what could be seen as best practice all around, look at the more successful countries, and quickly adopt the model that we are using. Okay? And then you can innovate and modify as you go along, rather than try to reinvent the wheel from scratch and let precious time slip by. Because COVID will not be waiting for you whilst you're doing the experimenting. So my approach would be take a look at the best success stories around and jump on the bandwagon.
I'm sorry for that. I think I was muted all this time. So yes, the question after the question on the poll question after the one on the regulator is, what kind of contact tracing method will our participants prefer? 11% of them said contact tracing method that discloses their identity, and 89% of them responded that they would prefer using an anonymous contact tracing method. On the question of which of these measures do you consider as critical for evaluating a contact tracing method, 11% of those that responded said the collection of minimal information. Another 11% required adequate security safeguards, and another 5% said collection of information for a defined purpose. 5% thought independent oversight is very important. 5% thought collection of information for a limited time is important. 11% thought transparency of the process is important, and another 42% said strict access to the information on a need-to-know basis, and then the right to access, and another 11% said the right to access all correct personal information. We have just about a minute, so I would at this point like to hand over to Drudesia to give us our closing remarks. We have just about a minute to go, and hopefully we'll have another round of this because the conversation was getting interesting. So Drudesia, I'll hand over to you to close us up.
Yes, thank you so much. I missed a part of this just recently, what you have been talking about. But what I would like to say about contact tracing, whatever the way actually people are trying, to locate the virus, either through manual contact tracing, digital contact tracing, or otherwise, what is most important in this context is that our information is not jeopardized. That is, it's landing into safe hands, and at the back end, we have the appropriate security controls to ensure that the information that is being received is well protected. At least, the very least, that this information is not being shared with untrusted parties for other compatible commercial purposes, etc. So this is what is most important to look out in this particular situation, because what we have done right now is that we have not in Mauritius used so much. I must say, it just started, but we have stopped the contact tracing being done through apps. Why? Because we couldn't guarantee the population that this information, because it's private sector agencies handling this information, we could not give the guarantee that this information is going to be used as it was actually meant to be. And so finally, we left it only with the Ministry of Health to do rapid testing, to do screening assessments. They have done around 200,000 testing with all the...
Thank you.
Yes.
Not to cut you, because the system is set up such that when the time is up, it cuts us off automatically. I just want to use this. This clearly shows that there's a lot more we should talk about, and I think we should have a part 2 of this very discussion. I just want to use this opportunity to thank you, Drudesha, very much, Felix, and then Nuria, for joining us, and to our many panelists who joined all over the world. We had, I think, more than 70 plus joining us today from all over the world, and we are going to also have the sessions recorded and put on all our social media pages so that a lot can benefit. But this is the beginning, and we'll get back to you because we need to have a second session of this. On behalf of ADRH, I just want to thank everybody who joined us today, and please follow our social media pages for a lot of these webinar series, as I said from the beginning. Thank you, and have a blessed day, everyone. Bye.
Thank you. Thank you.
Bye.
Bye-bye.
Bye, Drudesha.
Bye, Felix. Bye, Teki.
Bye.